I am Dr. Aadil Wasil. I am a cardiologist working presently at NRS Medical College and Hospital, Kolkata. Today we'll be talking about a few things regarding pulmonary hypertension. Pulmonary hypertension is actually a general term used to describe high blood pressure that occurs in the lungs. Like we have the systemic hypertension, which is the most common type of hypertension everyone knows about. There occurs the blood pressure within the blood vessels. Pressure within the blood vessels, it increases in the systemic circulation, general body circulation. At that time we call it essential or simply hypertension. If the same type of process occurs in the lungs, in the blood vessels of the lungs, if the pressure rises, that is called as pulmonary hypertension. So what happens? Like in systemic hypertension or routine, what we call as hypertension, the blood has to pump against increased or raised pressure. So with time, gradually heart has to work more and more to pump blood against raised pressure. Gradually over the years, over many years, 10, 20 years, the heart musculature thickens and ultimately it may not be able to keep pace with the rising pressure and the heart fails, left side of the heart fails. Similarly, if the pressure within the lungs or vasculature of the lungs rises, or what we call as pulmonary hypertension, the right side of the heart has to pump blood against the rising pressure. So once it has to pump against the rising pressure, initially it may lead to the musculature of the heart might increase and try to keep pace with the rising pressure in the lungs. But ultimately what happens is that the right lung, the right heart may not be able to keep pace with this rising pressure, and ultimately the right heart fails. So it is the process is a bit similar type as we see in essential hypertension. So, but in this case, it occurs on the right side of the heart. The right side has to pump against raised pressure, and ultimately, gradually, if the disease is not stopped or the progression is not stopped, the right side of the heart will fail. So the exact incidence, talking about incidence, it's not known. In the Western population, United States or other Western populations, it has been seen to affect 7 to 10 persons per million population. The exact incidence or prevalence within our subcontinent is not known. Maybe we may presume it to be the same as in Westerners, but the exact incidence or prevalence is not known. So how or when will we suspect, or when a patient should suspect, when a normal person should suspect that I may be having any sign of pulmonary hypertension? So its symptoms and signs are in early stages. The symptoms and signs may be non-specific, and the patient may not feel any significant or any specific symptom of chest or any pulmonary symptom. Gradually, as the disease progresses, the pressure within the lungs go on increasing, and it puts more and more pressure on the heart, more and more stress on the heart. So complaints gradually progress, and they may progress over time, and usually over 2 to 4, 5 years, the patient may progress to a stage of symptomatic disease, and at that time patient will have certain signs and symptoms. Like a patient will develop, the initial most common symptom is new onset, or if there is some previous breathlessness, that may worsen. So we will see that patient will have new onset or worsening of the breathlessness, or patient may feel dizzy, there may be some dizziness, or patient may feel like fainting, he may have some fainting episodes, or he may feel like he will faint, or especially if the patient does any strenuous exercise or any physical exertion. Patient may have chest pain, or patient may have palpitations, or what we sometimes feel of pounding or racing of the heart within our chests, that may be felt. Or with progression of the disease, there will be after the patient develops right heart failure, there will be symptoms like patient will have edema or swelling of lower limbs, patient will have swelling of feet, patient may develop swelling of his abdomen, the fluid may get collected in the abdomen. patients or fingers or lips may turn blue. So if patient has any of these symptoms, he should consult a doctor, and they should evaluate for presence or progression of pulmonary hypertension. So the disease is more prevalent in females. It is actually different types of pulmonary hypertension, and a type of disease which is idiopathic, where we don't know the cause, is called pulmonary artery hypertension, and that pulmonary arterial hypertension is more common in females, and especially in younger individuals between around 20 to 30 or 20 to 40 years of age. So other risk factors may include if a patient has a family history of pulmonary hypertension, or use of certain drugs like some anorectic drugs, drugs used for some weight loss, or the illegal drugs like cocaine or methamphetamines. They can lead to pulmonary hypertension. Or if the patient has certain associated medical conditions, especially in females, many females have connective tissue disorders, that may lead to pulmonary hypertension and right-sided heart disease or right-sided heart failure. Or many patients who are born with some congenital defect, congenital heart diseases, they may ultimately lead to pulmonary hypertension. Or liver disease, advanced liver disease may lead to pulmonary hypertension. Or even HIV infection, that can lead to pulmonary hypertension. So in routine medical checkup, it may be a bit difficult to diagnose, properly evaluate and diagnose pulmonary hypertension. But if a patient has symptoms of pulmonary hypertension like breathlessness, chest pain or chest discomfort, or feeling like patient he may faint, or dizzy feeling all the time, or patient develops swelling of feet, abdomen, that time he should definitely consult a doctor, and he should get evaluated himself or herself for presence or any progression of pulmonary hypertension. There are many diagnostic tests available by which we can diagnose pulmonary hypertension, especially echocardiography, in addition to ECG and chest X-ray. Echocardiography is a significantly important tool by which we diagnose pulmonary hypertension. Beyond that, if a patient there is any ambiguous diagnosis, patient may need further evaluation, which may be some of the evaluations are invasive. Now, if a patient is diagnosed with pulmonary hypertension, especially pulmonary artery hypertension, if it is pulmonary hypertension secondary to other causes, treating that cause may lead to improvement in the pulmonary hypertension. So that cause, underlying disease or underlying cause, needs to be treated all the time. Now, if patient has pulmonary arterial hypertension, which is idiopathic, where we don't know the cause, the exact cure is not available. The permanent cure, by which we will say that patient, we give this treatment and patient is treated forever, as of now we don't have permanent cure for pulmonary arterial hypertension, but we have definite very good newer drugs by which the signs and symptoms and the disease progression can be controlled and can be definitely managed, and patient can live his or her life comfortably, and the disease can be the progression can be stopped, or if not stopped, at least it can be halted, it can be significantly decreased. But important is that patient needs to comply with the advice of the cardiologist or advice of his or her physician, and patient needs to take may need to take drugs lifelong. And in addition, patient will need proper immunization, vaccines from time to time, that his or her physician will definitely advise him or her. And especially for females, if a young female is diagnosed with pulmonary hypertension, she should avoid getting pregnant. She should avoid conception, because the risk is significantly very high if a patient gets pregnant or if there occurs pregnancy. So wishing you all health and happy life ahead. Thank you very much.